I'm an adult and geriatrics primary care nurse practitioner and a member of Grand Rapids Black Nurses Association, also known as GRBNA. And we will be hosting a candid conversation on prostate cancer with men in our community. While prostate cancer cannot always be prevented, steps can be taken to reduce risk, and these will be discussed during the candid conversation. Prostate cancer is an important health issue and affects all men. However, it disproportionately affects Black men in both prevalence and outcomes. By understanding risk factors and being proactive in your health, Black men can, with early detection, improve outcomes for prostate cancer. So please join us for this candid conversation. Thank you.
Most men will die with prostate cancer, but they may not die from it.
Hi, my name is Andrea Robinson. I am an RN care manager, and the most important thing I would want men to know about prostate cancer that it's important to understand your risk factors. The risk factors include your age, your race, and your family history of prostate cancer or any other cancers. If you are a veteran, then you need to know if you were exposed to Agent Orange because Agent Orange exposure is directly related to prostate cancer. So we want to make sure that we inform patients that it's important to discuss your risk factors with your doctor or your primary care physician and get tested for prostate cancer. That's the number one um, way to make sure that you don't have adverse outcomes from prostate cancer.
My name is Juan Sanders. I am 59 years old.
Brady. I'm 59.
Okay, Dorsey Ligon, age 78.
My name is Alexander. I am 74 years old.
Hey, my name is Louis Montgomery. Age is 81.
And my occupation is caregiver.
I'm sanitation.
Retired OBGYN from Grand Rapids, Michigan, where I practiced for 43 years.
Occupation, retired postal employee.
And I'm retired public employed.
Well, it's in my family. My father, my dad, and my uncle. So, since it's a relative, so I had to go to the doctor more, get checked out.
So I went to the doctor, and I usually have an annual physical, and my PSA was off. It went from 2 to 6, and I thought that something was wrong. I was like, even though it's a small amount of movement, it tripled in a year. So I talked to my urologist. He said, let's do an ultrasound biopsy to figure it out. So we did the ultrasound biopsy, and what happened was next, they take 12 cores on the prostate itself, and one of them came back positive for cancer.
I didn't. My doctor discovered it and sent me to a urologist who told me after he examined me and took some samples of the prostate, that's when I found out I had prostate cancer.
I felt fine. I had an insurance physical, and the agent called me and told me that my PSA was elevated and I should follow up. And I was totally shocked. I had no symptoms. It shocked me. I immediately went to my desk in my office and sat there and started thinking the worst, thinking cancer, prostate cancer. I also tried to name pallbearers and just different people who I needed to contact.
It didn't. I wasn't let me put it like this. I wasn't scared. I was concerned. I wasn't worried. I was concerned. So I didn't have a mental breakdown, and it didn't affect me mentally at all.
Uh, it bothers me a lot. What it makes me do a lot of research. Makes you look at life a little different, especially like you'll never be how you say it you never you just it bothers you a lot. It gives you it messes with your confidence with women's. It messes with your confidence with anything because a lot of people don't like to talk about it, but it's here, and you got to be a strong person or it's gonna bother you. But other than that, you can't talk to any kind of woman. I tell you that it it bothers you. Confidence, your self confidence, self esteem. And I hear some people talk about you know bad things, but then you talk to them, you say, hey, look, I I go through the same thing. So sometimes people feel a little bit better just to hear it from somebody else. You know.
So I had a lot going on this particular year. My mom passed away. And then when I found out about my prostate cancer, I was shocked. I've had kidney cancer, and so I've already had a urologist. And my urologist, again, identified what was happening and explained to me, this is what's going on with you now. And, we can take care of this. So I was okay mentally about, because they caught it super early. And that's the big thing. If you catch it early, no man should die from this particular thing, this cancer.
Well, initially, it kind of, because I was watching it during the process, I had time to think about it. Uh, so it wasn't a surprise when we decided that, okay, we got it, we're going to do something about it, because it's about 3 months. I had about 3 months before we decided to do something. And I had decided I wasn't going to just sit and wait for something to happen. I knew I had a cousin who I gave a call. I talked to and told him what my diagnosis was. He had prostate cancer and he had radiation. Uh, but there was one thing, and he was the only person I talked to about it. He lived in Virginia. We talked on the phone. My sister's husband, my brother-in-law, died from prostate cancer. I wasn't going to tell her because it wouldn't have been good. Um, but he told me about the radiation, the type of radiation he was going through, proton something, I don't know what it was. Um, and he just encouraged me. So my mental state was, and I talked to my wife, of course, she was encouraging too. Um, I had just decided that, okay, I've seen enough people, I've talked to people, and, God has kept me this long, made me aware of what was happening, so I'm going to act on it. I'm going to do what I have to do. My mental state was, I wasn't thinking about death as much. I was thinking I was not going to let this be the thing that I want to die with it. I don't want it to do what caused my death.
I'm Cyrita Drake. I'm part of the Grand Rapids Black Nurses Association. I am a nursing professor and also a psychiatric mental health nurse practitioner. And I'd like to talk to you about the weight that you carry, the weight of strength and resilience. But true strength lies in protecting yourself, mind, body, and soul. And your mental health, it matters. It matters because Black men are 20% more likely to experience serious mental health issues, yet often less likely to seek help. You have pride, but pride is not in silence, it is in strength and courage. Therapy is not weakness, it's power. So let's talk about prostate cancer. It's your fight too, our fight, because Black men, 70% more likely to develop prostate cancer than others. Early detection can save your life. get checked, know your risks, and prioritize your well being. Taking care of yourself is not just self love, it is your legacy because you are king.
Um, it did not affect my manhood until I had the treatment, the irradiation, and then it slowed me down a little bit.
Well, I had a heads up because I talked to some people before, and they told me what their challenges were and what their doctors were telling them what they had to do. Yeah, at first it was like, okay, it wasn't like I was going to be running around looking for my wife and have been happily married. She knew what was going on. We shared what the what could happen and what may not happen. Um, but I also found out that there were things I could do to keep that going. At first, though, it took a while to get back to even think about it. And after a while, we tried some things to help enhance it. But I found out those things, those medications were not really helpful because they were affecting me other ways. I took one and I thought I was going to have a hemorrhage or something because it just wasn't working. And I think we found something that made it work a little bit better working with my doctor. So that desire for having sexual relations with my wife, I told her one of the things I had to do was I had to keep it on my mind. So she started to understand that every time I get flirtatious, it may not lead to anything right away. But now it works out better for her because now I have to make appointments. And that was something that we laugh about because she knew that there were times I would just wake up in the morning or late at night and say, "What you're doing?" Uh, but now she feels like she's in more control. But I'm okay with it now. It has not disappeared. I thought it was gone, but it has gradually come back. So I feel pretty good about that.
So my doctor told me immediately, he says, first of all, there are two things that's going to happen. One, he said, one, we want to get you cancer free. Two, we got to get you to stop leaking because you're going to have leakage after you have the prostate taken out because your prostate acts as a sphincter muscle that holds keeps your bladder from making you leak. So he said, those are the two most important things you have to worry about. The other thing that will happen is you will have some level of ED and you'll become impotent. And it takes about a year and a half for all your nerves to come back together. But he said that's the least of your worries because we got to fix for that. The biggest thing is be cancer free so you won't die from this. Again, no man should die from this because they got it under control. And two, you're going to be in adult diapers. It's a little embarrassing at times, but nobody knows you got them on but you.
You'd be surprised. I don't care what the rumors here and anything like that. It does not affect your manhood. Mentally, it might because they're going down in that area, but it has no effect on your manhood.
A registered nurse, and the wife of a prostate cancer survivor. Yes, prostate cancer will affect your sex life and your physical relationship with your spouse. However, you need to work with your urologist. You need to give it time. You and your spouse need to be patient and work on it together. There are other ways to be intimate during the process of recovery, and you guys have to do what works for you. But the most important part is being patient during the process.
Yes, so all my questions were answered. I have a great relationship with my urologist, as I said before. I had kidney cancer, so we have a good relationship. When this popped up, he had me a book called 100 Questions and 100 Answers. And it answers all the questions that you actually probably would have and explains in detail how the whole thing works as far as prostate cancer, what level you are, and those types of things. So that part was good. And then the access to care part was, again, get yourself a doctor, somebody that you regularly see and that you have a good relationship with.
Yes, my doctor, when they answered all the questions, the best way they knew how. But actually, when you go through it, you just feel like none of your questions are really been answered, because after what, it's like a year, after your year, they tell you, you might be all right enough to, or you might not. So it's a gamble, so it's a real gamble.
I had easy access to care, but um, they gave me quite a few choices. Do you want to watch this? Do you want to have a radiation? Do you want surgery? And back then they had just started the Da Vinci robot. So it's minimally invasive surgery. But I knew of all the side effects that will go along with prostate cancer and the treatment. So I was a little concerned about the side effects, and more so concerned about that than about the disease.
Yes, all my questions were answered. And I had easy access to care. The urologist referred me after he explained everything and gave me the options of what I could do. He says, "I want you to go see a radiologist." The urologist said he's a surgeon. He wants to cut, and mine was not to the point where I had to have surgery. So I went to a radiologist for a second opinion, and she said the same thing. Radiation would be my best option.
I'm Kiana Scott Ruffin, family nurse practitioner and also a member of Grand Rapids Black Nurses Association. I'm here today to share as a primary care provider the importance of seeing your doctor not only when you're sick, but for your yearly physical exams. During the physical exam, we're able to capture things and help prevent illnesses ahead of time. We've learned that 60% of African American men have an increased rate of mortality associated with being diagnosed with prostate cancer more than our white counterparts. There's factors such as race, socioeconomic status, and access to care that can affect your healthcare outcomes. As a provider, we can discuss with you tests to help screen and prevent the development of prostate cancer. And that can be something as simple as having a blood test done every couple years to check your prostate levels. If you do develop an elevated prostate level that's suspicious for cancer, at that time we'll refer you to a urologist to discuss further treatment options and outcomes. However, during that time, if you have any questions, it's always important that you maintain communication with your primary care provider as you start this journey to healing and recovery.
I would tell, depending on how old they are, I would say as soon as you can start the prostate exam. Don't be afraid to do that. It's just get checked every year. Watch your PSA levels. Know what it means when they get high, and just keep your eye on it. I also would say if you know people who've had prostate cancer, um, talk to them. They'll tell you you can get through it. I found out when I found out about it. Um, you know, you'd be surprised in my church, men that are in my church, when somebody said that they found out that they had prostate cancer, and they thought they were by themselves. And we were probably about 20 of us, and about 6 or 7 guys raised their hands, and said, "Yeah, we know what you're talking about. We've been through it." So it's something that you can get through. It's not as bad as you think it is. Just know what your options are.
Well, my advice to any man is to get checked out. Um, Always stay up on I should say your physicals and stuff like that. But if you know anybody in your family that has it, it's best to get it checked out, especially if you under 40. When you get around 50 mark, that's when you start getting it checked out.
Get a PSA early. Many times doctors will not order it as far as a blood panel, but if you request a PSA, I would say starting at about age 40, if you are African American, and maybe 50 if you are of another color. Okay.
I would tell other men that get checked every year for a physical, especially get all of your big signs taken care of. PSA is the #1 marker for prostate cancer. Make sure when they draw your blood to make sure you got a PSA value. Keep track of that value and have a good relationship with your doctor. The other thing I would say is, be diligent. At around 55 to I think 62 is when prostate cancer usually happens, especially with Black men. So we have to be diligent enough to not be afraid to go and find out.
Okay. And what is PSA?
Prostate, it's an antigen that's in your bloodstream for your prostate.
Always have a checkup, at least once a year, if not twice a year, depending on your age, from 45 up, and have everything checked. Do the colonoscopy, the colon test, the prostate test. It only lasts a little bit, and it doesn't hurt. It might be embarrassing, but it doesn't hurt.
Most Black men die from prostate cancer because they don't have a regular physician that they see on a regular basis or a relationship. It happens to us between the ages of 55 and 65. And we miss the signs. If you got leaking, it's hard for you to go to the bathroom. You have to push a little bit, or you find yourself struggling to pee or urinate when you have to go. That's a sign of having an issue with your prostate. You should go immediately and discuss that with your physician and have that relationship where you guys can talk about it, get your PSA checked, and make all those things happen for you. No man should die from this.
I would say if you get the diagnosis and once they biopsy and everything is confirmed, find some people to talk to who have gone through this, and it'll probably help you make a decision on treatment. If we can catch it early, then you stand a chance of being cured, and the side effects will be minimal for the most part.
The reason why I'm here, because I want especially Black men to understand this is not a death knell. It doesn't have to be unless you ignore it. I can say I know people who've gone through it, including myself. I've known those who've had it removed, those who've had radiation, but I also know those who did not survive it. And those who didn't survive it did it because they ignored it. And like I said, I tell the same thing my doctors told me. Most men will die with it. They don't have to die from it.
It would be profitable for all men to have that test, because catching it early, there's no problems. Cures, it can cure you right up, but the longer you wait, the worse it gets. So catch it while it's early, and if you keep the exams up, there'll be no problems in life, and it will not affect your manhood if you do it right.